Hello, and thank you so much for joining us today, Dr. Ashley Walker.
Thank you so much for having me. I'm so happy and thrilled to be here with you today.
Yes, thank you so much. Okay, so do you mind expanding a little bit for us of who you are, where you're from, and what are you doing currently?
Well, I'm Dr. Ashley Walker, and I'm known as Dr. A1 because I am a twin. Both our names begin with A, but I was the firstborn, so I'm Dr. A1.
Oh, I love that.
Yeah. You may be wondering what kind of doctor I am. Well, I'm a pharmacist, which means that if you go to a doctor for any sort of surgical procedure or any reason at all and a prescription is written, my job is to make sure that the medication is compatible with you, that there are no contraindications, that there are no incompatibilities with other medications you may be taking. Sometimes certain foods interact badly with medication, and so my job is to make sure that that doesn't happen. So I also advocate for deaf and hard of hearing people in healthcare. And I've noticed through my journey as a pharmacist the struggles that are out there because there are very few deaf or hard of hearing people in this field.
Right, right. Absolutely. Yes. I honestly am surprised, shocked, excited, happy to see yourself as a doctor in the field, in the medical field. You're right. I haven't seen much of this thus far.
Not only that, but my experience is twofold and unique because I've experienced it from both sides as a colleague, but also as a patient. I've worked with nurses, therapists, psychologists, medical professionals of all kinds in my work, and they're all hearing. When they interact with a deaf or hard of hearing person, that's when things get a little bit awkward. There's a sense of fear and an uncertainty as to how to approach a deaf or hard of hearing patient. During my time in school, there was no mention of interacting with and working with deaf and hard of hearing people. So it wasn't until pharmacists were out in the world and they were in a situation where they were working with a deaf or hard of hearing person. If they have a family member, then they have that familiarity. But if not, which most people don't, then they don't.
That's right.
So what I do is I help medical professionals try to find resources for working with deaf and hard of hearing people and understand that communicating with deaf people and hard of hearing people is different from individual to individual.
Right. And if you don't mind, I want to ask you something that came up for me while I was listening to you. Thinking about intersections of yourself, meaning the many layers, as a deaf woman, as a woman, Black. Have you experienced any barriers or struggles through your journey becoming a pharmacist with these intersections?
Oh, yes. Yes. Now, I'm from the South, Louisiana specifically. And it's hard. Not only am I a woman, but I'm also a Black woman. And then to add that third layer, I am deaf.
That part, yes.
And it's interesting. My experience at an HBCU, historically Black college or university, is where I'd always heard that they would be very supportive for Black students, but that was not the experience that I had. When you add that third layer of being deaf, they have no experience with that. So my experience at an HBCU as a Black deaf woman was not great and was full of struggle to get services. Other Black students who may have had other disabilities had an easier time. Let's say they were using a wheelchair. But as a deaf person, it was an immense struggle. I went for 2 weeks every semester without an interpreter.
Oh, wow.
Despite the fact that I had given them my schedule ahead of time, they already knew what my schedule was, I still struggled to receive services. Not only that, once I was done with school, I was one, a deaf Black woman. People see a Black woman when they see me, but they don't see that I'm deaf immediately. And I'm not hiding it, but once they realize it, things become a little bit awkward.
Yeah, that is hard. Yes, because oftentimes when you go to a place, a facility, a institution for acceptance, you know what I mean? Like as a Black person going to an HSBC, excuse me, at HBCU for, the Black experience, Black university, and then you get there and you find out, oh yeah, there are some struggles I'm experiencing. There is an afterthought as for myself being deaf. Yeah, that is definitely a difficult challenge. How did you advocate for yourself to overcome that within your journey? You are so successful now. Wow.
To be honest, I first got into deaf rights at RIT, the Rochester Institute of Technology, because there I never had to ask for interpreters. I never had to ask for note takers. It was already there. So it was that foundation that prepared me for the world outside of RIT. So I knew what my rights were. I knew what I could ask for, and I knew what I needed. For example, using an IEP in a college setting and knowing how to use it to get the services that I need, learning how to procure the appropriate medical verification from the doctor's office to receive services. But the university had never experienced that. So I found that really interesting, and also knowing how the law works. Most schools receive federal funding for students with disabilities. And often you'll find an office of disabled students on campuses, and they receive federal funding, but they weren't providing appropriate services with the money they were receiving. So that was a shock. So I used my knowledge to say, you're receiving this federal funding, I want these services. So it's essential to know your rights. And I hate to say it, and it's unfortunate, but a lot of people equate being deaf with being dumb.
Yeah. Yes, I'm aware of that.
So it's true that they think that, but it's important to know what you can and cannot do and how to navigate the system.
So true. Yes. Know your rights. Love that. Great tip. Okay, thank you so much for sharing about your journey and how you arrived to your place where you are today through school, universities, things like that. I'd love to know more about your daily work today.
I work in a couple different settings. I work in the hospital, and there my role is not as a director, but I'm in charge, meaning that I am to make sure that we are legally compliant. I do research. I hate the research, but I do the research to make certain that if there's a code that happens in the hospital, that we have the equipment ready at all times. My job is to make sure everything is up to spec. I have to make sure that it's available, that the equipment's not out of service, that it's not no longer good. And so I have to make sure that all of that is done. Then also, I am responsible for going on rounds with physicians. For instance, if the doctor is going on rounds in the ICU and seeing different patients, they have a team, and my role in that team is to advise on medications rather than the doctor having to go and call for medical or medication advice. I'm there as a part of the team.
Nice.
And so my job then is to make sure to handle that, and that there is a capable home health nurse there that's able to administer that therapy to the patient and to work out the logistics around that. I also make modifications and adjustments to medication with the approval of the physician. This way, the patient isn't forced to miss a dose while we're waiting for a response from their doctor. We can, under the doctor's approval, make those adjustments and modifications and keep the physician in the loop on that, making sure that we are keeping the patient safe. Now, when I'm not at work, I'm advocating. I teach other pharmacists, nurses, doctors how and where to find resources to interact better with their deaf and hard of hearing patients. At the same time, I also educate deaf and hard of hearing people on how to use their medications appropriately.
Wow, that's a lot of responsibility and a lot of your own, shall we say, responsibility to the community as well. You know what I mean? Like your innate ability to advocate for the community. Thank you so much for that. I do have a question when you mentioned that you do your rounds with the doctors on the floor, for example, the ICU floor. How did you communicate with the team when they would ask you questions as a pharmacist for your expert opinion related to patient care? How did you interact and communicate with them?
Well, I don't have an interpreter that accompanies me, so I rely heavily on lip reading. It's exhausting, to be sure. As you know, lip reading, you're not going to catch everything. So while someone is speaking, I am mentally processing what's being said. And I will repeat back what it is that I understood to make sure that I was clear. It's no secret that many doctors have accents, which adds an additional layer. And if I'm not understanding, then I ask them to write things down. It's important that my team knows that I am there to support them. But in order for me to do my job effectively, communication must be clear. And if that means repeating something, then be willing to do that. We do tend to meet before rounds begin. Our team will meet to make sure that we're all on the same page. And if I feel that the doctor might be difficult to understand, I will go to them and have a one-on-one to make sure that we're clear and that we're on the same page. But if there is a modification that needs to be made to medication, that's something I do with the collaboration of the doctor.
Wow, okay. I'm trying to imagine a perfect solution for this. Do you mean sometimes you experience challenges with this situation, even though there's agreements before you go in to do your rounds, you still experience challenges? Do you mind expanding a little bit on that?
These medical teams may have up to 6 people moving around at the same time. And if we have more than one person talking at the same time, it becomes difficult to know who's speaking. Additionally, the hallways are narrow, and our team will want to walk and talk at the same time, and that makes it challenging to know who's speaking.
Right, right. What's your perfect solution for a scenario like this? Walking and talking at the same time with your team of six, making your rounds of different rooms on the floor. What's your perfect solution for this situation?
Personally, I would prefer to have an interpreter because sometimes things are just better signed than in English words. You know what I mean? And it's often quicker to read it in sign language than to read words. And I'm often having to see it again. But when I'm listening to someone or paying attention to them, I'm often translating it into sign language in my head anyway.
Oh, okay. Okay. Yes, yes.
Because when I see it, I can see what it looks like. And so it's easier for me rather than just relying on the words.
So would you prefer that ASL, the sign language in the glasses?
Yes, definitely.
Okay. Well, I think I might have a solution for you.
Oh, okay. I have met 2 other Black deaf pharmacists within the last 2 years. And their experiences mirrored mine, the struggles with employment. Honestly, it took me around 8 months after I graduated with my degree before a job even contacted me. The problem is that most companies use recruiters, right? So, when I would call and leave my phone number, the phone number is connected to a video phone, and the person who calls back wouldn't know how to use a video phone or what to do with a video phone, so they would hang up. And so I realized I was going to try something else, because there were times too when the person would not let me know which department they called from, so I couldn't reach out to them. So what I did was I'd give them my mother's phone number because she has a tendency to not answer the phone if she doesn't recognize the phone number, which forces them to leave a message. And then when they leave a message, she could let me know about the message. I call back using voice carryover and using my voice through the video phone. Then, once I'm called in for an interview, I let them know that I'm deaf. I didn't hide it. I am a deaf woman, but that I am a deaf woman.
Oh, so much education that's needed. And I do know that about deaf people having to give their mom's number or their family members, or unfortunately, even their own children passing their number, and I experienced that myself as a coda, having to listen, get the message, and then passing that on to my parents and letting them know this person called and things like that, or even just interpreting that message. Yeah, I totally get that. And there's a lot of people who unfortunately just don't really understand. They just don't get it because they've never had to experience it.
Right, right.
Right. And I want to talk more about the technology and also want to know about your speaking engagements that you do. I know that you do a lot of those in the education settings. I saw you teaching ASL classes and going to do speaking at different companies and businesses, teaching them how to best interact and engage with deaf and hard of hearing. So many different things that you're doing. And I know you mentioned a little bit earlier, but I would love to know more.
Really, it's just making the world a better place, a more accessible place for deaf and hard of hearing people and for my precious little ones.
Yes, yes, the kids.
Honestly, the world is not your worst adversary. If you tell yourself you can't do something, you'll start to believe it. If the world tells you no, that doesn't matter. But if you're telling yourself you can, if you believe in yourself, it doesn't matter what the world says because they don't know what your capabilities are. They don't know what your potential is. You know what your potential is. You know what you're willing to do and you know how far you're willing to go. You are the sole determiner of that. The world can influence it, true enough, but the final decision is yours.
Yep, that's right.
When I sit down with kids and they ask me about my career as a physician and how that happened, and they think that that's impossible, I tell them, no, it's not. It's absolutely possible. You can do it. It will take hard work, yes, but you have to work hard because you live in a world that's made for hearing people. But with the advances that have occurred in technology, it's made things so much easier. We have SignGlasses, video phones, AI. The list goes on. You just have to know where to look because it's out there. And you may wonder, well, how can I do this job if I can't speak? The technology, it's there.
Yep, that is so true.
But people who don't have that experience don't know. At the same time, they're not looking to find out either. It's easier to dismiss rather than accommodate. But each disability can be accommodated. Instead of asking the question, we want to ask what opportunities I'm willing to give this person to succeed.
Yes, and you said it right. It starts with the babies. It starts with the kids believing that they can. They see a role model like yourself and they say, I can do that. Yes, I know it's hard, but I can do it. Wow.
Yes.
What would you want to share with deaf and hard of hearing community members who are looking at you and trying to better their lives as well, just like you have? Or maybe they're looking to have a better communication access, a smooth experience like you have effectively done.
Number one, I would say be happy with who you are and know your worth. Because when you know your worth, you won't just accept anything. If you don't have anyone to support you, I'm here to tell you now that you are worth it. You're alive for a reason, and you are not a mistake. You're not a mistake. If you want to become a dancer, a football player, a basketball player, a track star, a doctor, a dentist, a nurse, a police officer, a firefighter, go for it. Dream big. If the world tells you no, you tell them you are your own boss. Technology is your friend. Use it. If people won't listen, show them. Just show them.
Oh, wow. Yes, it's such a beautiful message. I love this. I wish, well, I hope everyone will see this because it's so important to first know my self-worth, you know? It's so important. That's number one. You feel confident in yourself and you can advocate for yourself and you can advocate for others and take what you need. I love that.
You have to know your rights rather than just taking what's given to you. If something doesn't make sense, ask questions, ask why. Don't be afraid because there's no such thing as a dumb question. If you don't understand, that's okay. But we can't help you to understand if you don't ask.
Yes, you're making me think of the saying, stay curious, remain curious, ask questions. You know, if it doesn't feel right, you feel hesitant, ask questions, do your research. That's right. In terms of staying curious myself, I want to ask you a couple questions about your dream state of technology that's best fitting for yourself in your everyday life, what that looks like. I'm curious. Maybe it's not built yet, but I want to know.
I've really been thinking about technology more since the birth of my children.
With the children.
They are losing their baby teeth, and it makes it even harder to understand them. It becomes a real struggle. So I'm often thinking, what sort of technology might be available that can help me to communicate better with my children? Because sometimes, if they're too upset, it's very difficult to understand them. And at that point, I'm like, help me to help you. So something light and portable with the ability to transition from interpreting to captioning easily,
Yeah, I love that.
and something that is easily and readily available instead of having to reschedule things because of lack of resources. I could put on SignGlasses and conduct business rather than having to reschedule my children's appointments because the interpreter wasn't available. That would make things a lot more convenient.
Like an all-in-one thing. Love that.
Yes.
Yes. Thank you so much for taking the time to join us
Yes.
and have a discussion here at SignGlasses, where we have the technology where we provide deaf and hard of hearing individuals access through smart glasses, through our mobile app and various devices, anywhere, anytime. So I'm so happy you were here with us, and we all are looking forward to staying in contact with you.
Thank you so much for the opportunity to share and giving me the opportunity to let people know that the frustrations they've experienced, that also people need to be able to speak up for themselves. So thank you for giving me the opportunity to show the community, especially the deaf and hard of hearing community, that I see you. I know your pain
Such a heartfelt message.
because I've experienced it, and I don't want future generations to have to fight the same battles that we've had to fight.
So true. Such an important message. Thank you so much.
Take care.
Have a wonderful rest of your day. Thank you.